We're going to talk about what this condition is. We're also going to talk about some pathogenic causes for this condition, some drugs that cause this condition. We're also going to talk about how we can determine severity and how to treat it. So acne vulgaris is a common chronic or recurrent skin condition that presents with non-inflammatory and inflammatory lesions. We'll talk a bit more about what these non-inflammatory and inflammatory lesions are a little later. It is the most common cutaneous disorder in adolescents and young adults, and its onset is generally in the pre-adolescent period, and its incidence decreases with age. So generally speaking, acne vulgaris typically resolves in the 30s, so 30, 35 years of age, but it may return again as what we call de novo in adulthood. So if acne has resolved, it may actually come back later in life. So what is the pathogenesis of acne? There are actually 4 key components of the pathogenesis of acne. The first one is infection with a bacteria known as Propionibacterium acnes. It is a gram-positive bacteria. It's also known as Cutibacterium acnes. The second part of the pathogenesis is follicular hyperproliferation. So essentially a lot of skin cells being formed and produced. The third part of the pathogenic cause of acne is excess sebum production. So sebum is essentially the oil of your skin. It becomes produced in excess amounts. And the fourth part of the pathogenesis of acne is inflammation. Talk about why you get inflammation a little later. So what happens generally is there is a formation of what we call a microcomedone. You can think of it as a precursor to the skin lesions, the non-inflammatory and inflammatory skin lesions like whiteheads, blackheads, pimples, those types of things. The microcomedone then progresses to a comedone. So microcomedones are essentially a plug of skin cells, and it progresses to the comedones that you see in acne themselves. And with regards to acne, the most common areas of the body that are affected by acne are generally the face, the chest, and the back, because these areas contain the most sebaceous follicles. And because they have the most sebaceous follicles, it fits in line with our third key component of the pathogenesis of acne, excess sebum production. So the sebaceous glands make sebum, and wherever you're going to have a high density of these sebaceous follicles, like the face, chest, and back, you're going to have more of acne occurring in those areas. So there are a list of drugs that can also lead to or exacerbate acne. Some of these include phenytoin, isoniazid, lithium, and glucocorticoids. So steroids, you can think of dexamethasone. Cyclosporin can also lead to acne, disulfiram, azathioprine, and EGFR inhibitors. So these are some of the classes of drugs that can cause acne or lead to worsening of acne. So I just wanted to mention these for completeness sake. We talked about it a little bit, but what we generally do is we break it down into non-inflammatory and inflammatory lesions. Non-inflammatory lesions are the whiteheads, so these are what we call closed comedones, and blackheads, and these are called open comedones. So closed comedones, they're essentially a little area of a sebaceous gland that is filled and it's not open to the air, essentially. Blackheads are the opposite. They're actually an open pore full of oxidized lipids and even a little bit of melanin that actually cause their darkened color. These are the non-inflammatory lesions. What happens is if any of these follicular or follicles rupture, they can lead to inflammation. And in addition to that, the immune response to Propionibacterium acne. So if you've got any bacteria in there, your immune system can respond to it. It can actually lead to inflammation in that site and lead to inflammatory lesions. So again, non-inflammatory lesions, whiteheads, blackheads, you can get some follicular rupturing and some immune response to the bacteria in those lesions can lead to inflammatory lesions. So the inflammatory lesions are kind of what we think about with acne. Inflammatory lesions include papules, so they're tender to touch. Pustules, they actually contain, you can see these are little pustules here. Papules themselves may not actually see, you might actually not see a white or yellow tip on them. They just might be red and tender. And nodules are a deeper collection. You can see them, they're red, they're swollen, but they don't have that yellow tip or white tip to them. And then cysts are essentially nodules that are even larger. So they're the largest lesions. When we call them cysts, they're generally severe and very large. So whiteheads and blackheads and those pustules and papules are kind of common presentations, but there are a few other presentations of acne I want to talk about here. The first one is acne fulminans. Acne fulminans is essentially an acute eruption of large inflammatory nodules in ulcers. So it's a very severe condition where there's a large area of the body that becomes affected with these big, large inflammatory nodules and ulcers. An individual that gets acne fulminans is someone that has pre-existing acne in the first place, and it can be triggered by isotretinoin. And interestingly, isotretinoin is actually a medication we can use to treat acne. So some individuals can have a bad reaction to isotretinoin and lead to acne fulminans. And they can also have systemic symptoms as well. So they can have fatigue and a lot of other issues systemically. And generally speaking, this condition most often occurs in males. A second presentation I want to talk about with regards to acne is acne conglobata. Acne conglobata is essentially very severe nodules of acne. It generally affects the back, chest, and face. They can get sinuses, they can have draining tracts and cause very bad scarring, and this condition generally affects young males. And the last one I want to talk about is what we call acne excoriae. Acne excoriae is when an individual has usually mild comedones. They're not very bad, but they are chronically and usually what we call obsessively picked. And what this does is essentially leads to almost ulcerations of the skin and can lead to occurs in young women. So these are the few different presentations I wanted to talk about with regards to acne. Now, there are a variety of factors that can worsen acne or make it even more pronounced. These include the following. These include increased androgen levels. So there are associated conditions that can have higher levels of androgens than normal. This includes polycystic ovary syndrome or PCOS, and even having tumors of the adrenal gland or ovaries can lead to worsening acne. Skin irritation, anything where there's excess of washing with soaps and detergents or skin picking, anything that dries the skin out can worsen the area, can exacerbate the acne. A family history of having bad acne is an influencing factor for having acne or having worse acne, and stress. So stress can also lead to worsening of acne as well. And I want to talk about it here. I won't go into much in detail, but I wanted to mention that there's actually not a whole lot of significant evidence of a dietary influence on worsening of acne. So the evidence is not there yet, so I don't want to say anything with regards to diet at this point. So how do we make the diagnosis and how do we treat acne? The diagnosis of acne is a clinical one. It's based on history and physical examination. Severity of acne is important. We have to determine the severity of acne in order to determine the proper treatment for acne. Severity can be mild, where there's few to several comedones. It can be moderate. Moderate is many comedones, so can be more than several, so it could be 4 or more. And severe is when there's widespread nodulocystic, so there's nodules that we've talked about, very aggressive lesions that cause scarring. So when you think about the severity, especially severe acne, I want you to think about scarring. If you ever see anybody getting scarring from acne, it is severe, and that's going to determine what we use for treatment. So the treatment of acne is determined by the severity of acne. So first of all, there's non-inflammatory acne. So some of those comedones we've talked about, the blackheads, the whiteheads, you can use topical retinoid for that. With regards to mild, when there's mild papules or pustules, maybe some comedones, you can use a topical retinoid, and you can add benzoyl peroxide and or a topical antibiotic. Generally speaking, you don't need the antibiotic at this point, but sometimes you can use it. The other severity, moderate papules and pustules, you use the topical retinoid and oral antibiotics and topical benzoyl peroxide. So the oral antibiotics are generally a tetracycline, usually something like doxycycline. You can use topical retinoid and an oral antibiotic and benzoyl peroxide, very similar to the moderate, so you use the same. Or you can use oral isotretinoin. Oral isotretinoin is kind of the big gun for treating acne. So you can use this, but as we mentioned before, some individuals can actually have a worsening. They can have an acne fulminans reaction due to the isotretinoin. So just wanted to talk about each of the severities and each of the treatments. Again, non-inflammatory acne, you can use topical retinoid, and then you add to that topical retinoid with each increasing level of severity. So you can add benzoyl peroxide and maybe a topical antibiotic. In moderate, you definitely add the antibiotic. So again, doxycycline is generally the choice. And then with severe, your option is oral isotretinoin at that point. Or you can still use the topical retinoid, oral antibiotic, and benzoyl peroxide. So what are some of the complications of having acne? A lot of them can be psychosocial. So depression, low esteem, and anxiety are very common in individuals with acne. Another one is hyperpigmentation. If you had lots of acne in the past, you can get scarring. You can have a hyperpigmented lesion, essentially, that stays with you after the comedones have resolved. And you also can get scarring, as we mentioned before. So again, when you see scarring, it's severe acne. think about what we talked about with treatment with the option of an oral isotretinoin. And another complication of acne is what we call solid facial edema. And this is a condition known as Morbihan's disease. It's essentially facial swelling with erythema. And its intensity fluctuates over time. It waxes and wanes. And it actually improves with the isotretinoin as well. So this is something to kind of think about. Anybody who has had bad acne, they get